Bismillah ar-Rahman ar-Rahim, everyone. Assalamu alaikum. I hope all of you are doing well, and I hope all of you have submitted your homework. النهاردة هنكمل كلامنا على PubMed. Remember last time we talked about PubMed, we talked about searching using mesh, medical subject heading, and the use of medical subject heading and how it is more beneficial and more concentrated than just using keywords. لو انتوا فاكرين دي الهوم بيج بتاعت PubMed، النهارده هنشوف ازاي نسيف search history in PubMed. search history يعني ان PubMed keep track of your search، يفضل فاكر انت دورت على ايه قبل كده. هل دي مفيدة؟ طبعا مفيدة. السيرش هيستوري هتلاقيه under advanced search. ده on top of the page هوريكم فين بالظبط. ده keep record of your search strings. strings يعني ايه؟ لو انا قلت rheumatoid arthritis and exercise, that's a string. rheumatoid exercise and rheumatoid arthritis and exercise and outcomes, that's a string. So these are called strings. If it keeps track of my strings, then I can combine these strings with each other or with other keywords, especially لو أنا عندي synonyms يعني كلمات بنفس المعنى. مثلا older adults, old لوحدها, elderly individuals, كل دي كلمات بنفس المعنى. فأنا ممكن ألعب بالكلمات دي أغيرها بحيث إن أنا أميك شور إن أنا ألاقي كل الارتكلز اللي أنا بدور عليها. Combining search strings often narrows the research and reduces the number of hits. ازاي؟ ان انا مثلا دورت مرة على rheumatoid arthritis and exercise, probably I will end up with hundreds of articles. But if I say rheumatoid arthritis and exercise and hydrotherapy زي ما عملنا قبل كده, then fewer hits. So usually when I combine strings, I get fewer hits. Is this a bad thing? No, it is not a bad thing. Actually, it is a very good thing because I'm going to end up with articles that are relevant to my question. I'm not getting hundreds of articles that are not really concentrating on my question. Again, لو أنا عملت search على advanced mode, and here is the advanced search. If I click advanced, then I'm going to get to this screen. In this screen, I can combine my search. This is the field that I'm entering my search. So I'm going to search in all fields. I'm going to search for rheumatoid arthritis and exercise, and remember aquatic or hydrotherapy. And I'm going to say add to history. So I want the PubMed to keep track of the history. So far under history, there is no recent history. So there is nothing there. So if I click add to history and look for this, search for this, this is what's going to happen. It gave me a search on rheumatoid arthritis and exercise and aquatic or hydrotherapy. I added outcome in one of my searches. So the outcome is there. I used a filter. Remember, we used filters before, humans. So this is my second search. My first search was rheumatoid arthritis and exercise and aquatic or hydrotherapy. I still used in the filter human. So when I used this first search, it adds the search on top. يبقى ده most recent, ده old. لما أنا دورت على rheumatoid arthritis and exercise and aquatic or hydrotherapy, طلع لي 25 articles. لما حطيت outcomes, remember outcomes اللي هي measurable outcomes اللي هي الريزلت بتاعت التريتمنت في الآخر. لما حطيت outcomes طلع لي بس 8 articles. طبعا لو أنا السؤال بتاعي related للoutcomes يبقى أحسن لي 100 مرة إن أنا أخد السيرش ده، لأن بس 8 articles دول اللي related للسؤال بتاعي. لو بصيتوا فوق على ايدكم الشمال هنا هتلاقوا ان الفلترز are activated، ان انا استعملت فلترز. هنا الفلتر بتاعي كان humans. لو انا عايزه اكليك على search details اشوف PubMed عمل ايه في السيرش بتاعه، ايه الديتيلز اللي اخدها او الخطوات اللي اخدها في السيرش بتاعه، هلاقي كله مكتوب هنا: arthritis, rheumatoid, and then arthritis and rheumatoid, or arthritis or rheumatoid and arthritis and exercise. So كل الديتيلز بتاعتي هنا. الحاجات اللي موجودة في المش بتتقال، يعني exercise is a mesh term, hydrotherapy is a mesh term, aquatic is not a mesh term, and so on. Okay? All right. Another feature يبقى احنا كده اتكلمنا على ازاي ان انا استخدم الهيستوري علشان ينارو داون السيرش بتاعي. Another feature for PubMed which is very very useful especially for the clinicians، للناس اللي بتعالج عيانين كل يوم. This is a very useful feature which is called clinical queries. Clinical queries or clinical questions, this is again the home page of PubMed. Clinical queries is right here. So if you click on clinical queries, what's going to happen? It will allow you a more specific research for studies related to etiology, the cause of the disease, the diagnosis of the disease, the prognosis of the disease, the treatment of the disease, and the prediction or prognosis or the rules for prediction for the disease. It can direct the research to narrow down or expand the search عشان تدينا the highest quality form of evidence. Highest quality form of evidence لو أنا عايزة systematic reviews. Remember this was on top of the pyramid of evidence. Systematic reviews يبقى أنا specify إن أنا محتاجة systematic reviews. ده هيقلل number of articles that will come. So if I'm going to just specify systematic reviews, remember systematic reviews is one of the best evidence. You can read 1 or 2 articles of systematic reviews and get a lot of information instead of reading hundreds and hundreds of articles. All right, so if I go to PubMed and I click clinical queries and I put here rheumatoid arthritis and exercise and aquatic or hydrotherapy, and I clicked systematic reviews. Now the category is therapy. This is a pull down menu. You can choose anything. So I found 5 of 7 articles that are listed here. So 7 articles. Only 4 of those are systematic reviews. So I have 4 articles that are systematic reviews that I can read. So this is one of the highest evidence that are present. So it gives you 5 of 7 articles, and the next page will give you the other 2. And it gave you the under systematic reviews, it gave you 4 articles that are related to systematic reviews. So clinical queries are extremely beneficial and extremely useful for clinicians who want to get the answer really quickly, a clinical question really quickly. And remember that you can ask a question about the cause of the disease, the diagnosis of the disease, the treatment of the disease, and also the prediction rules for the disease. So it's very, very wide spectrum of questions that you can ask, and you can also specify systematic reviews to get the bottom line very quickly. Okay, so clinical queries are very, very useful for clinicians. Another feature of PubMed is called related citations, and I'll show you where that is. Related citation can really help with the search. Of course, from the name, you know that they are suggesting articles that are related to the article that you picked. So when you look at the abstract of the related citations of any article, you will find the label related citation. If you click on it, it will take you to articles that are similar to the one you are reading. يعني مثلا أنا عملت I searched and I got an article and I'm looking at the abstract of this article. هتلاقوا جنب الابستراكت كلمة related citation. If I click on related citation, it will show me many articles that are similar to the one that I'm reading. One caveat means خلي بالك, one caveat, that it will expand your search. So you'll get many, 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 many more citations. Why? Because it's looking for any of your keywords. So rheumatoid, arthritis, exercise, all of these are keywords that is going to be used. So keep in mind that if you click on related citations, that you're going to end up with a lot of articles. Let's do this. Again, I did a search on PubMed. I got this abstract that is talking about rheumatoid arthritis. And here is related citations in PubMed. If I click on related citations, that's what I'm going to get. I get 92 articles that are related to the article that I am reading. If you are going to related citations, that's when you can't find something and you really want to expand search and you really want to look. And you can look at the titles. If the titles are not enough, you can narrow down the search or look at the abstract. Keep in mind, because I didn't pick English language, this is the one between brackets. This is not English. So make sure that you pick the English language. This is not English. This is not English. So this is English. This is English. So these abstracts are not very useful because they're written in a different language. Okay? All right, so that's related citation. Up to this point, we have talked about one database, which is the largest database in the world for scientific literature, and that's the PubMed, medical scientific literature, and that's PubMed. There is another database that is useful for physical therapists as well, and this database is called the Cumulative Index of Nursing and Allied Health Literature. The acronym is CINAHL. CINAHL is short for Cumulative Index of Nursing and Allied Health Literature. It is plus, this is the name plus with full text. من التايتل عارفين ان الداتابيس دي هيبقى فيها a lot of physical therapy لانها allied health literature وهيبقى فيها nursing وكمان هيبقى فيها full text. full text يعني ايه؟ يعني مش بس هتديك الابstract of the article, it's gonna give you the full article, which is very, very useful and a great service. CINAHL Plus with full text is a database of citations from journals pertaining to nursing and allied health professions. ومن ضمن allied health profession طبعا physical therapy, ممكن يبقى فيها occupational therapy, ممكن يبقى فيها speech therapy. All of these are called allied health professions. حاجة من الحاجات اللي بتلمت الأكسس لسينال إنها بفلوس. It has a subscription fee. I don't know if you can access this through the university. I asked Dr. Hanan, and you can ask her if you can access this through Cairo University. Those of you who are working in hospitals, probably the hospital paid for CINAHL. So check with your hospital, check with the university, and see if you can have access to CINAHL, because it is not for free like PubMed. It is with money. I don't have access to CINAHL except through my university, because the university pays a fee for the whole university, and I get access. So if I want to go on CINAHL, I have to go to the website of my university, go to the library, and then access CINAHL through the library. I cannot access CINAHL from just the normal website. Okay, this is just the name of the company, and it is for the individual users who do not have access through an institution. And institutions usually in the university أو hospital بيبقى عندهم حاجة اسمها site license for the hospital or license for the university. One of the great features of CINAHL that it has some journals that are not indexed through PubMed. يعني في مجلات مش هتلاقوها في PubMed. Remember, PubMed has very, very rigorous criteria. Not every article is published or cited in PubMed. If the article or the journal is not cited in PubMed, it could be cited in CINAHL. So some journals you will not find in PubMed, you can find in CINAHL. For example, Journal of Aquatic Therapy, Aquatic Physical Therapy. This journal is not in PubMed, but if you are interested in hydrotherapy, if you check on CINAHL, you will find a lot of articles from this journal. Okay, so one of the great features about CINAHL that it is one geared towards health professionals, allied health professionals. So it is not spread on physics and chemistry and other things. It's just for allied health. The other thing that it includes journals that might not be included in PubMed. CINAHL links to online journals and full text articles, so this is another plus. It is easy to understand search pages. Search strategy is not as complicated as PubMed. هتقدري تلمت الكاركترستكس بتاعت السبجكتس من ناحية السن, gender, characteristic of the article or publication. You can look for a specific date or for a journal type. You can specify the treatment setting. You can pick inpatients or outpatients. You can pick a special interest areas, physical therapy, complementary medicine, etc. Automated suggestions for additional limits for the research, ability to review and retrieve hits by citation only. So ممكن يدينا list of citations only. ده homepage of CINAHL. As you can see, there is a place where you put your keywords, and this is the boolean. Remember, booleans are terms that are used either to expand or narrow down the search, and is remember, and will narrow down the search, and or will expand the search, not will narrow down the search. All right, so these are the search options. You can limit the search modes and expanders. Boolean phrases, this is what we use, the Boolean phrases. Limit the results to full text only or abstract. Maybe I want just the articles. I can click on this. Apply related words. It can apply synonyms or related words. Search within the full text of the article, so it's not just in the title or in the abstract. You can click on that. By the way, هنا select the field. You can select either the author, the journal, the abstract, and so on. So you can do the date, you can do anything, you can list the name of the author if you're looking for a specific author. The rest of the page, it has clinical queries. If that's what you're interested in, you can pick these options. Human, clicked on human here. Language, you can pick any language you want, the gender or the sex, the male, female, and so on. Pregnancy, inpatient, outpatient, special interest, if you want any specific special interest like chiropractic care, and so on. So you have limited options really in CINAHL. You don't have a whole lot of flexibility in the search. So if I look for rheumatoid arthritis and exercise and aquatic or hydrotherapy, I got the same 4 articles that I got before. As you can see, the first one is a randomized and controlled trial of hydrotherapy in rheumatoid arthritis, which is an excellent evidence. I can get the full text by Get It at my university, or you can get the full text of some articles. Remember, randomized controlled trial is one of the top evidence that you can find. So if I read this article, I should learn a lot about the use of hydrotherapy in rheumatoid arthritis. Okay, so these are the advantages of CINAHL and how to use them. The Cochrane Library is another database that is very common in for all scientists to use. It is old. It has features that are different from PubMed and different from CINAHL. The Cochrane Library is maintained by an international organization called the Cochrane Collaboration. So the Cochrane Collaboration is the body that is in charge of the Cochrane Library. It is potentially more efficient for evidence about intervention. This is very important to remember, that this is about intervention. يعني إيه؟ يعني about treatment. Okay, لو أنا if I have a question about the cause of the disease, if I have a question about the prognosis of the disease, if I have a question about anything else, maybe the Cochrane Library is not the best source for the information. It has 6 different databases. So they divide the databases into 6 different subsections. The most useful for us, this is the homepage of the Cochrane Library. The most useful for us are the top 3. The first one is the Cochrane Database of Systematic Reviews. Remember, systematic reviews are wonderful reviews. The thing is that these reviews are made by the Cochrane Collaboration. So these systematic reviews are done by the body. They are very rigorous. There are systematic reviews and meta-analyses that are developed according to very rigorous methodology. So the rules are very, very strict rules for the reviews. And they are established and executed by members of the Cochrane Collaboration. There is another data set that also has reviews. It publishes abstracts of reviews, but this one is of effects of treatment. This database is very useful as well. The people who review these studies are not the Cochrane people. They are researchers, other researchers who are not members of the Cochrane Collaboration, but it's a very useful database. The third database is Cochrane Center Register of Controlled Trials. Remember, controlled trials are good studies. So it is a database of citations and abstracts of randomized control studies. So that's a good place to look for good evidence for any question. Okay, remember the question is about interventions only. The Cochrane Library has basic and advanced search page, so we can search either the basic search or an advanced search. Neither has nearly the number of options to expand or limit the search as compared with PubMed and CINAHL. So the Cochrane Library is more general than PubMed and more general than CINAHL. Again, it needs subscription, so a subscription fee is required. Those of you, again, who work at hospitals, ask the library. Maybe they are subscribing to the Cochrane Library. If you don't have access through an institution, you can't really get to the Cochrane Library. If you are a member of the American Physiotherapy Association, I don't know if any of you is a member, you can get to the Cochrane Library through the APTA website. This is the homepage of the Cochrane Library, and as I told you, really it's very limited in terms of expanding or narrowing down the search. So if I limit my search to only Cochrane reviews and I enter rheumatoid arthritis, exercise, aquatic or hydrotherapy, I ended up with only 2 Cochrane reviews, and these reviews can be very useful if you're looking at intervention effect or treatment effect. So that's the Cochrane Library, and again, it has you need subscription to go to it. Remember, I just told you that the search limits are very limited. So the database, you can check Cochrane review, other reviews, trials, methods, study. You can check any of the status, limit the search to the following, either all new, or for Cochrane reviews only new searches, only conclusions, only major changes, only withdrawn, any of these topics. You can do all years, or you can do between this year and this year. Again, in the last 5 years or last 5 months or whatever, you can choose the date either this way or this way. All right, so these are the limits. As you can see, very limited flexibility with Cochrane review. Another database that could be useful for physical therapy is called Physiotherapy Evidence Database, or PEDro. Every time I say physiotherapy, not physical therapy, you know that I'm probably talking about something in Australia or in Canada. In America, they call it physical therapy. So Physiotherapy Evidence Database, or PEDro, is actually out of Australia. So it is Center for Evidence-Based Physiotherapy in Sydney, Australia. It has over 24,000 randomized trials, systematic reviews, and clinical practice guidelines in physiotherapy. One feature for PEDro that is different from any other database, that it has rating. So when it includes a study, it rates the study on a scale from 0 to 10. 0 means it's very bad, of course, and 10 means it's a good study. So at least when you are getting the article, the citations, you're getting a list of references, at least somebody looked at the paper and gave it a grade. So of course, grades less than 5, it's not a very good study. Grades that are above 5 and closer to 10 are good studies. The rating scores will appear next to the citation in the search results to help the user prioritize which studies to review first. So if I get, for example, 10 articles, one is 3 out of 10, one is 4 out of 10, one is 9 out of 10, one is 7 out of 10. I'll probably look at the 9 out of 10 and 7 out of 10 before I look at 3 out of 10. Okay? The reviews and the practice guidelines, of course, are not rated. They only rate studies. They're not going to rate a review, or they're not going to rate practice guidelines, which makes sense. PEDro is just for physical therapy. So that's another reason why PEDro is a great database. So it is really geared towards physical therapists. So it's a great source for physical therapists. You can search by the therapeutic approach, clinical problem, body parts, physical therapy, subspecialty, for example, hydrotherapy, manipulation, mobilization, neuro, whatever, any subspecialty of physical therapy. Not only written but also video tutorials are on the website, so you can actually watch a video of how to use the website, and the tutorials using the PEDro rating scale and determining the usefulness of the evidence located. This is the PEDro homepage. As you can see, you can either search, simple search, or an advanced search. Okay, so if I do a search, for example, I want to look for, again, rheumatoid arthritis, hydrotherapy. Balenotherapy was one, this is an option, this is a pull-down menu. So balenotherapy was one that is associated with hydrotherapy. Balenotherapy is the spa therapy. In the problem, I put pain. I didn't put any body parts. I didn't put any of this. And then I searched. I got a lot of articles. If you can look for the article, for example, this is an article, long-term efficacy of Reden Spa. So maybe I don't want to look at this one. Although it is a good article, the score is 9 out of 10. So I'm not going to select this article because it is talking about radon, and I don't want this. This is a randomized controlled trial of hydrotherapy and land exercise overall well-being and the quality of life in rheumatoid arthritis. This seems to be a good article. It received 7 out of 10, so it is considered a good article. So maybe I will select this one. So you don't have to look at all these articles. You can select the ones that you like. You can click on this and look at the abstract and decide if you want to select it or not. Okay? So after I select, I can actually look at the abstract. I can remove this record or I can keep this record. It has the title of the study, the source of the study, the method, which is a clinical trial. It received a 7 out of 10. The subjects are, was the therapist blinded? No. Blind assessors? No. Aquatic follow-up? Yes. Intention to treat analysis? No. So you can see a lot of questions here that are answered for you under the method score. So the score, 7 out of 10, is related to all of these details. And this is the abstract of the study. So you can decide, if you can't decide from the title, you can decide from the abstract if this is something that you want to use or you want to remove from the record. Okay, so that was PEDro. The last one I'm going to talk about is the American Physical Therapy Association's Hooked on Evidence. Hooked on Evidence actually was born in California. And I was one of the people that really worked with Hooked on Evidence when it was started in here, because this is where it really started, and I know a lot of people who worked on this, and my students worked on this too. The database hooked on evidence, of course, it's coming from the APTA, so it is only physical therapy. And it was really created because of the emphasis on evidence, evidence-based medicine, evidence-based everything. So physical therapists had to practice according to the evidence. So hooked in evidence was created because of the emphasis on evidence-based practice. It is a database of citations concerning the effectiveness of physical therapy intervention. Again, this is only about intervention, about treatment. It has nothing to do with etiology of the condition, diagnosis of the condition, the clinical measures, the prognosis of the condition, or any of that. So all of these aspects of the disease or the condition are not included. Okay? The study to be included and to be on hooked on evidence, the study has to be about human subjects. The study investigates at least one physical therapy intervention. The study includes at least one outcome measure of the intervention, and the study was published in an indexed English language peer-reviewed journal. So if it was published in non-peer-reviewed journal, it would not be included. If it is in any other language rather than English, it will not be included. This is the homepage of Hooked in Evidence. Hooked in Evidence actually was for free. But now, really, the APTA decided to make it for free. So you can actually go on Hooked in Evidence without subscription. You have the option of advanced search, and I clicked this option. And you have a pull-down menu for the journal. For the design study, if you want only clinical trials, random clinical trials, you can include that. If you want only infants or only toddlers or children, you can pick that as well. All right? So again, it is a unique benefit of Hooked is the type and amount of details in each article. I'll show you an article now. For my students to actually articles محطوطة by volunteers. So the volunteers get the article, they read it, and then they answer questions on the Hooked on Evidence website. So there will be a lot of details that are included for you on the Hooked on Evidence. I'll show you an article right now. It has inclusion and exclusion criteria. It has the design feature, if it is random or not. It emphasizes quality appraisal process for evidence about the intervention. It has clinical scenarios. It talks about function. And all of these things are available to you on Hooked on Evidence. The drawbacks or the disadvantage of Hooked on Evidence that it has very limited number of extraction. We call it extraction because we extract the information from the article and put it on the website. So it depends on volunteers. So if people volunteer to do that, then you will find the information. If people don't volunteer to do that, then the information is limited. So far, and so many years after Hooked on Evidence was introduced, is still very, very limited in number. Lack of citations pertaining to other elements of patient-client management process. Remember, I told you it's related to intervention only. So if I have a question about anything but intervention, then Hooked on Evidence is not the best data to go to or the best database to go to. So again, it is dependent on APTA member submissions, so of article extraction. For example, in my class, I had every student submit one article. So that was one of the things that students did in my class. I observed them, I reviewed their work, but they volunteered. It requires APTA subscription in the past, but now is available for free. So every one of you can go to Hooked on Evidence and search. The advanced search page has limited number of options, age group, type of research design, journal name, and that's it. It doesn't have a whole lot of options. This is the extraction that I was talking about. So this is an article. The article is called Effects of Balance Training on Functional Outcome After Total Knee Replacement in Patients with Knee Osteoarthritis. It is a randomized control trial. These are the authors, and so this is the citation. So if you look at the extraction, the person who extracted this article, he had to enter information under target condition, so arthritis and allied disorders. Element of patient or client management model, it is intervention. Practice pattern, it is musculoskeletal pattern. Okay, under musculoskeletal, it's impaired joint mobility, motor function, muscle performance, and range of motion associated with joint arthropathy. The design type, it's clinical trial, and it is random. The study population, adults from 18 to 64 years, older persons 65 years or older. Okay, so it had adults and older people. The population location, outpatient, ambulatory care, so these were not inpatients. You will see inclusion criteria, exclusion criteria, how many subjects, and so on. So this is the extraction. So you can see that it takes a lot of time to actually read an article and fill out all of this information about the article. Again, Hooked on Evidence is just for physical therapists. Now it's free. It is related to intervention, not any other aspect of the disease or the condition, but it gives you a lot of information about the study. There are other databases and services that I don't want you to, I think I gave you the 5 most common ones that are used by physical therapists all around the world. We talked about the advantage and disadvantage of each one. And we talked about how to search each one of them. Of course, I'm not going to cover all databases in the world, but there are so many. I left you with some names in here if you want to, but we're going to only study those ones. I hope that was not too much for you. I know each one is different from the other, and you need to remember that. Let me help you with the questions on the final. So how would I ask a question about the databases? I'm going to ask a question that you might have in the clinic. I'll tell you, for example, you have this patient and you need to make sure that, for example, ultrasound is useful for this patient. Okay? So which database would you choose that is the shortest way to get your answer? And to get the best evidence. Remember, best evidence means systematic reviews or randomized controlled trials. So where would be the best place to look if you want to know this, the answer to this question? So when you go through the databases that we talked about, remember which one would help you answer which question. So that would help you a lot in the final exam. All right? Okay, thank you so much for your attention, and I will talk to you next week, inshallah. Assalamu alaikum.